Hello and welcome to Health Dialogue Show. I am Dr. Bhumika and today we are addressing a condition that often stays silent until it's too late: stomach cancer. Early symptoms can be so subtle that many people mistake them for routine acidity, indigestion, or general stomach discomfort. But what seems normal can sometimes be the body's early warning system. In today's conversation, we'll unpack why stomach cancer hides behind everyday symptoms, who needs to stay more alert, and how to recognize these quiet signals before they turn serious. To guide us through this important discussion and help clear the confusion, we have with us Dr. Abhishek Kakroo today. Dr. Abhishek Kakroo is an MD Internal Medicine, DM Medical Oncology. Dr. Kakroo is a dynamic medical oncologist of his team. He began his practice in oncology in 2006. He completed his DM in medical oncology studies from Gujarat Cancer and Research Institute, Ahmedabad in 2009. He underwent training at the hematopoietic stem cell transplant unit at GCRI Ahmedabad. His area of expertise is medical oncology like hematology, pediatric oncology, adult oncology, hematopoietic stem cell transplant services, etc.
Yeah.
So, what are the common symptoms of stomach cancer? Can you enumerate them?
Basically, stomach cancer is sometimes also very silent, and people rarely come to know about it till it has gone to a very advanced stage. But one needs to be very careful. At today's fast life pace, you tend to have a lot of symptoms of rightly gastritis, eruptions. You have early, bad food habits leading to a lot of what do you say stomach upsets. So these are some of the very early, so constant gastric fullness, constant gastritis, your decreased appetite, weight loss, could be some of the earliest manifestations that there is something wrong with the stomach, or maybe even the intestines, but there is something wrong with the GI tract and needs to be evaluated, especially if the symptoms persist for, let's say, beyond 4 to 6 weeks. It warrants thorough investigation.
Right, sir. So, coming to the next question, what are the risk factors for stomach cancer and any specific risk group that is affected by it?
When we used to long back, about 30 years back, in our MD days, used to be told that the only risk factor for stomach cancer is smoked fish or charcoal fish, which was common for Japanese people. It's a novelty there. That's the only risk factor for stomach cancer. But then I think things have moved a long way from there. uh, as I told you, your lifestyle, your eating habits, a lot of fast foods, I would say, although it's very difficult to pinpoint, but food habits, lifestyle, and a lot of infections, including H. pylori, a lot of things are now involved in causing an increase in this problem, which we have seen in the recent past. It's no longer just the traditional factors of smoking, tobacco, or your smoked fish. As far as risk groups go, so there are known hereditary uh, reasons for stomach cancers, although very few you will see in clinical practice that you have a hereditary stomach cancer. You have a family of patients who has a stomach cancer, but then there are known hereditary risk factors for that also. You should be aware about that. And I think risk factors, as I told you earlier, start from your habits. Dietary habits have a lot to do with it.
So, so is it true that stomach cancer can look like simple acidity for months?
So that is the problem. So many a times, so stomach is like, what do you call it? It's like your dustbin. So everybody wants to throw into it, and it's like you generally don't look into it very very keenly, that you have some stomach issues, you have some gastritis, you have stomach upsets. People tend to ignore it or treat them with their routine medicines, over the counter medicines. So I wouldn't say that every stomach issue should be investigated and has to be in cancer, but if you have persistent symptoms in the form of, as you rightly said, bloating or gastritis or stomach upsets, weight loss, they need to be investigated. I don't think they can become a routine part of life. And if they are a routine part of life, let's say for more than 4 to 6 weeks, they have to be thoroughly looked into. So symptoms are so common. It's like just a smoker. If you ask a smoker, Whether you had coughing, he would say, yes, I have coughing. Most smokers would keep coughing, and they believe it is due to the smoking that they are doing, they are coughing. But then that is the initiation of lung cancer sometimes. Similarly, in stomach, you tend to have gastritis maybe more often than not in your routine life, and one tends to feel that this is okay and nothing has to be looked into. But as I told you, if it persists for a longer period of time, I think definitely it has to be looked into.
All right, sir. Because sir, the symptoms are very normal. I would say
Yeah,
like people suffer with them like on a regular basis. We would say. So why does the
agreed.
stomach give silent signals instead of strong symptoms?
So strong symptoms means, see, it's a big organ. It has a lot of space till the time the tumor goes big, and there is, let's say, you have problems in people start vomiting, or they have maybe a hematemesis or a blood in their vomit, or maybe developed, if it's near to the pylorus, they start developing symptoms of obstruction. They do not generally reflect onto the patient, or patients keep losing weight because of a lack of appetite. So being a big organ, there is a lot of space there, which is the case with most. So even in, if you go with colon cancer, there is a lot of space involved there, and unless and until the symptoms become very prominent, you generally don't tend to attend them, or you just can't find any, let's say, thing to pinpoint. But then, as I told you, see, there are you can't pick everything in anything. In today's day and age, what I feel is more common is you have refluxes, you have severe reflux gastritis, esophagitis leading to lower GE junction and stomach cancers, which is more common rather than your traditional cancers, which you miss happening in the stomach or the pylorus, which cause obstruction and maybe late obstruction, and you so miss them. You'll find more patients having a reflux problem, and that has to do with their lifestyle, that has to do with their feeding habits, causing reflux esophagitis, which we generally neglect, leading to Barrett's esophagus, and maybe even stomach, causing G junction and upper stomach cancers. So that you need to be wary about.
So also we see our like recently in recent times our diet has changed, our lifestyle has changed. So does our modern lifestyle increase the risk of stomach cancer?
So that is what I was telling you. That to me, that is the number one reason why this disease has not only the stomach, but I think even the gallbladder, your liver, and your colon cancers. The all of these cancers have definitely increased from the past 20 years. The incidence, the prevalence. Also, we are able to pick it up much more better. But then the incidence and prevalence has dramatically increased, and that has to do with the lifestyle, the food habits. So the westernization of our diet, I think, is one reason why we are having a lot of GI malignancies.
So my last question to you is, if someone's watching this, what's your one line advice regarding stomach cancers?
Forget stomach cancer. To every one watching, that's my advice to them, regardless of the type of cancer. If you have any symptom in the body, it might be a headache, it might be a bloating, a gastritis, it might be a it might be a constipation. If you have it for, let's say, for a certain period of time, I won't tell you that if you have a problem for a few days and you run to your doctor and get a PET scan done. But if you have it for, let's say, 4 6 weeks, I think anything persisting beyond that, even a, let's say, a cough, if it persists beyond a certain period of time, let's say 4 to 6 weeks, you should be definitely at least trying to rule out what's going on. There's something wrong. And I think that is a first step to looking into whether we are missing something or not, whether the patient has a lung cancer or a stomach cancer or a colon cancer. At least you are looking, trying to find ways of evaluating what is going wrong. But neglecting those symptoms for beyond a certain period of time, and maybe keep taking over the counter of medicines, let's say a simple back pain. So you can have back pain for 1,000 reasons, but you have a good enough back pain for which you are taking medicines daily, and it has been persisting for the last 2 months. I don't think then you can neglect that. You should be at least visiting your doctor to try and find out what's going wrong, and maybe a specialist to look into where the problems are, not just taking over the counter medicines.
So thank you so much for speaking to Medical Dialogues. It was a pleasure to have you on board with us today. Thank you so much.
Thank you. You're welcome.